Alright, so who should be making cold calls? Well, the answer to this is everyone, okay? Everyone should be making cold calls. If you're a new agency, you better be making cold calls, and a whole lot of them. Look, a cold call, okay, is easy to make. You can literally make about one cold call every 5 minutes, right? One cold call every 5 minutes. So you can literally average yourself just a minimum 15 phone calls. 15 phone calls. Average an hour. This is if you can actually be good at being able to get that. Typically, when you first start, you might even get the phone hung up on you within a matter of 1 minute of a conversation. Alright? Your job is to be able to spark interest within 15 to 20 seconds. Most people, within 15-20 seconds of them first speaking to you for the first time, already made a decision if they don't want to talk to you no more and try to get rid of you. So you need to be able to make a phone call last. And if you can make a phone call last more than 3 minutes, that means you at least piqued some interest. And this is of continuous conversations. So understand that if you're a new agency, you better be making a lot of phone calls. And just because you're an old agency, that does not mean you should not be making a lot of phone calls either. Because understand this, just because you're an old agency, that doesn't mean you guys are doing things sufficiently. And that's why we want to be able to give you guys the training. Administrators, definitely. Director of nursing, yes. Secretary, yes. Alright. And for some of you secretaries out there who's looking to transition to become marketers, I'm sorry I called you a secretary, administrative assistant, or whatever you guys want me to call you guys, okay? Nurses, definitely. Therapists, yes. Physicians, social workers, marketers, liaisons, everyone in your team should be cold calling. And everyone should be trained to be able to learn how to be able to make cold calls. You know, how many times have you had a patient? I've heard stories about this where patients, you already have a doctor referring a patient to you, you have the patient agreed to ready to have that initial admission or that nurse to visit him, right? Yet your nurses are not good in phone skills and breaks rapport with the patient, and all of a sudden the patient says, I don't want services anymore. I know this happening to so many agencies. Just because you've already got a referral source, just because you already got a patient, that doesn't mean that you get to keep the patient, because they may say no.